Welcome back to the Bryan Devore Connection. I'm your host, Bryan Devore. The missing link for care. What is that? Well, care is super important for seniors, but a lot of times there are some components that they don't quite get, and they need some help with that. So here to talk to us today about that is, someone I really like because she's on my team. Her name is Alex Valiere. Alex, how are you doing today?
I'm doing great. Thank you for having me.
Yeah, my pleasure. So Alex is an agent on my team. She's also a seniors real estate specialist. And you and I met, was it before COVID or during COVID? We had coffee, I remember.
During COVID,
Okay.
yes, I invited you to coffee because I really admired what you do.
Yeah, and we talked about real estate because you were thinking about going into real estate, and you eventually did, but then you saw there was more to be done. Let's first talk about your background. Your background was home health. Talk
Yes.
about that.
Yes, I think it's worth noting kind of what the intention of home health care is. And so ultimately, I was in home health for years, taking care of 10,000 plus seniors. The intention of home health, it's a program built by Medicare, and ultimately it's to help seniors be well at home. You'll see that I wear black and yellow often because be well at home.
Oh, I like that.
Yeah. And ultimately, we want to keep seniors out of the hospital as preventative as possible. And so home health is something that's covered by insurance. It's where clinicians are ordered by a physician to come into the home wherever that senior calls home and essentially help them with their clinical needs, nursing and therapy. And with that, they are meant to do a home safety evaluation. What are your clinical needs and how can we help you with your diagnosis? And secondary, let's do a home safety eval and make sure you're safe at home. So yeah, that was my time in home health and really was just kind of passionate about being well at home.
Yeah, for sure. And in doing your home evaluations, you saw a need, and you and I have talked about this before about, what happens when they need home health, but maybe home's not the right place.
Yes. So, I'm taking care of, or I was taking care of patients where they were discharging maybe from the hospital or skilled nursing many times. It's actually a part of a safe discharge plan, and I know we'll kind of talk about that.
Yeah.
But the hospital would go, okay, I think this senior's safe at home based on self-report or maybe something that the family reported. And when we got into the home, often we would find that they weren't safe. And we're assessing for their activities of daily living as a part of that. Are you able to get out of your own bed and into a wheelchair so you can make it to the kitchen? Can you get into the shower and out of the shower by yourself? And so when we were doing these assessments, many times we'd learn, we're not safe at home. What's our next plan? Yeah.
Yeah, and so you wanted to go into real estate to sort of kind of solve that, and I like how you take the idea of social worker approach, to real estate, because the home is where people need to be safe, but if they're not safe there, so then what? So you wanted to put together a safe discharge plan for seniors in doing real estate, and I don't want to say that Alex only works with seniors. She works with all kinds of clients. But especially seniors who are discharging. And I know that when someone is discharging from maybe a skilled nursing, maybe they shouldn't be going back home. Maybe it's not safe. And then what? So you want to fulfill this missing link.
Yes. And I feel like it's worth kind of just thinking about almost like one scenario that we could kind of walk through. So let's say, we have a senior who's at home. She's independent with all of her activities of daily living. She's doing pretty great at home. And unfortunately, she suffered a stroke. She goes into the hospital. The hospital decides you need a lot more rehab than what home health can provide. We'll send you to a skilled nursing facility to get that daily rehabilitation and get as strong as possible. I think, in many of these cases, let's just say that this senior has children that live out of town and she is no longer safe to discharge home. This is a, important piece because I think that it's worth this skilled nursing going, okay, we're not safe to discharge home. Many of these seniors, let's say in this scenario for this client or otherwise patient, she's on a fixed income. How are we going to be able to navigate this space of helping this senior to discharge home safely wherever they call home?
Yeah.
And how is she going to be able to afford care so that she can do simple things like get out of bed and enter a wheelchair? I actually have a client that I'm working with right now, and she's moderate assistance, so she needs the help of another person to get into her wheelchair from her bed, and max assistance in the bathroom.
Yeah.
And she doesn't have anybody. So I think that, in creating a safe discharge plan, it's identifying maybe, okay, we don't have a safe plan. Our real estate is our biggest asset that we've, many times that we've invested in our lifestyle. And so how can we help this senior that's not going to go home to utilize this asset so that they're safe and comfortable and aging in place as best as possible?
Yeah. So you and I kind of sat down and kind of crafted this safe discharge plan, bringing in other partners as well to help with the entire process, identifying the need, talk about placement, the real estate. So let's walk through that plan.
Yes. So, I mean, let's talk about this scenario where somebody had a stroke. She's in a skilled nursing. She's meant to discharge. Geez, that's scary.
Yeah.
I mean, you don't know what your next step is. And so I think that, we really like to bring in unofficially as a social worker. We're not social workers, we're realtors, but it's our duty to our client to make sure that they're in great hands and happy. And so ultimately, upon discharging, it's getting a placement agent involved and perhaps having that placement agent, which they go out, they find out what's going on with this client, what their wants and needs are, what's important to them, and kind of finding different options for them so that they have choice in where they'd like to call home next, because we want them to be well in wherever their next home is.
Right.
So yeah, we call in many resources. Maybe it's a placement agent. Maybe the senior is going on to hospice and they have beneficiaries, but they don't have a trust set up yet. How do we get them connected with resources, maybe a trust attorney, to really set themselves up for success? So, I really liked your program, Bryan, because I feel like you already built this unofficial social work-based program. The senior move management piece.
Yeah.
I mean, okay, you had a stroke, you're in a skilled nursing, you can't do things for yourself.
No.
How overwhelming is it that you're needing to move out of your home and you have this asset, you have this opportunity so that you can move into assisted living? How are you going to move out?
And by the way, it's like in 2 weeks, because now you're going to have to start paying, maybe a higher rate by staying there because, they don't have custodial beds or, there's so many things going on and it's like a turbocharged situation. It's not like we have time to do this.
The 2 weeks makes me think of something, which is like, in healthcare, things are moving very quickly. Or maybe we have a change in condition. We were going to be safe to go home, but then 5 days before we discharge, we're no longer safe. Something happened. Right. We fell, we broke our hip, something. And, I think that a secondary program that I kind of thought of when you brought that up is there's loan programs. Hey, how can we get you a loan so that you can afford to move into this assisted living while we make sure that we're getting your home ready and prepared as we would for a traditional sale to get you that equity in your home. So, that's another resource that I think is really important and just kind of great for our seniors to have access to.
Yeah, and it's things they don't know about. And why would they? They've never been in this situation before. So what you're doing is you're really educating the social workers in the skilled nursings, the people who from your years in home health, but now you're going out there with a different badge as the social worker real estate person, but the hub of the wheel of all these different resources that you can bring in to help that discharge, because the last thing that social worker wants is that person to discharge home where it's not safe or not know what options are available. They want to watch out for this person.
Right. I mean, a long-term discharge plan and really kind of going above and beyond for your patients. You can see those social workers that really kind of put their heart and soul into why they're a social worker. Right. I think it's worth noting that home health, yes, that's covered by insurance, but I learned through my time in home health that the cost for care can be quite high. I mean, we're talking about between $5,000 to $30,000 a month, depending on kind of what the level of care is and what you'd like. And so, going back to real estate being our biggest asset many times, in my 20s, my late 20s and early 30s, I purchased my first home, sold that home, and purchased the home that I live in now. And I think I have a unique perspective on that too. It's like I am passionate about helping folks purchase their first home, because I see that that is such a great asset, whether it's, a wealth asset or maybe when life throws you a curveball later on in life. I get to see that every day.
Right.
So,
and we've had some successes already. You've been on the team now for, as of airing of this, about a year, and we've already helped some folks make the transition, discharge successfully. The social worker's been very happy. patient, client has been very happy, and we connect them with the right placement person, get them in the most appropriate place. It's working. You can see it in action. And I know we want to do a lot more because it's only growing. The need is only growing.
It feels good. I mean, it's such a puzzle to move around all these pieces to help the senior, but it feels good to be that person. So
yeah, for sure. So give her a call if you are in this situation, or if you are in a skilled nursing, if you're a social worker, and you want these resources for your skilled nursing facility. She's the one to talk to. Her information's on screen. And valued part of the Devore Realty Group. Alex, thanks for coming today and sharing your wealth of knowledge.
Thanks so much for having me.
My pleasure.